Few of your patients for today. Please make sure you care for them properly. Miss Woods is in room 668 and is complaining of abdominal pain. Try to figure out what's causing her source of pain. Hi, I've been assigned Mrs. Woods. Can you give me any advice on how to care for her properly? She's a very nice woman. She's getting anxious and just wants to know what's going on. So try to develop a trusting relationship with her and make sure you put caring first. Also, try to instill some faith and hope in her and create a supportive environment. Great, thank you. Make those my objectives along with helping to find her source of pain and minimize it. Hi, Mrs. Woods. I'm Jessica. I'll be your nurse today. Is there anything I can get for you before we get started? No, thank you. And please call me Amy. I just want to know what's going on with my pain. My anxiety is getting worse the longer I sit here. My goal is to find out what is going on with me. Don't worry, Amy. You can trust me. I'm going to do everything I can to figure it out. Thank you so much. I feel like I'm in the right hands. You are. Don't hesitate to ask me if you need anything at all. I'm here for you. Thanks. That means a lot. My anxiety is beginning to diminish already. No problem. That's what I'm here for. Now let's get started. Amy, when did you first start experiencing abdominal pain? About a week ago. It seems like it's getting worse every day. I think it might be menopause. Okay, how about I perform some tests to see if this is an obstruction or menopause? Either way, you'll find out by the end of the day. That would be great. To begin, I'm going to get some blood from you to test. Is that all right? Yeah, that's fine. Great. Okay, I'm just going to put this IV in just like this. How are you feeling? I'm good. Thank you for asking. Okay, just like that, we're done. That was good. Thanks, Jessica. Now I'm going to take you to get an x-ray of your abdomen and pelvic regions. This will be simple and quick. I'm just going to lay a vest over you once we're in there, and then I'll step out of the room, and you'll be done. Okay? We're all done. Let me just get these results back, and I'll be back with them as soon as they're finished. Is there anything I can get you in the meantime? No, thank you. I wonder when she's going to come back. I'm so sorry for such a long delay, Amy. I've been out with other patients, and I've been recording the results. I've begun to feel like you have forgotten about me. But if you have the results back and you're ready to go, then I completely understand. I'm not your only patient. The results of the x-ray showed that there was no obstruction to your abdomen, which is good. However, your blood results show that you are pregnant, which has been what's causing your discomfort. I'm what? I'm 49 years old. I was expecting menopause, not pregnancy. Now, I understand that this may be shocking to you, Amy, but it is possible to get pregnant late in life. I will explain to you all your options. You may go through with the pregnancy, it is safe, or you may terminate. You're only a few weeks along, so either option is available. Termination is not an option for me and is against my faith. I'm going to keep the baby. I completely understand. I know you have 2 children in the past. If there is any information I can recall for you. No, but thank you for being so supportive. This may not have been what I expected, but I'm willing to take anything God throws at me. You can do anything you put your heart to. I'm glad we're able to find the source of your pain today. I will bring in your OBGYN to come give you more information, and you can set up your future appointments with her. Thank you for all your help today and helping me solve my problems. I appreciate your hard work. You're very welcome. The OBGYN should be in soon. Have a wonderful day, Amy. I'm glad I was able to help find Mrs. Bush's source of pain. I feel like I've gotten so close to her girl in this relationship, it'll be hard to say goodbye. It happens sometimes. Just realize that you've helped her all that you could, and you did a wonderful job. She'll be in good hands. Thank you. During the pre-interaction phase, the nurse got information from the previous nurse that was with the patient and also from medical charts. During the orientation phase, the nurse was able to get acquainted with the patient and build trust. Miss Woods allowing the nurse to call her Amy is a form of trust and relationship building. They also work together to establish goals. During the working phase, the nurse and patient continued to have a trusting relationship and created a supportive environment. They worked together on meeting the goals of the patient. During the termination phase, the nurse made sure that all goals were met. The patient felt that she was properly cared for and referred to someone that could help her with the rest of her pregnancy. She also reviewed the feelings of the relationship. Examples of nonverbal communication that was used was when the nurse smiled, touched Mrs. Wood's shoulders, and made eye contact with her while speaking. Examples of verbal communication that was used is when the nurse explained procedures to Mrs. Woods with a clear tone of voice, and when she was speaking with Mrs. Woods about her anxieties, she used a soft, sympathetic tone. A few bridges and barriers were also demonstrated during the relationship. A barrier during the orientation phase was when Miss Woods was experiencing anxiety. A bridge used to help her get past this barrier was when the nurse was able to talk with Miss Woods about her anxieties and help her feel more at ease. Another barrier that happened throughout the relationship was during the working phase. The nurse told Miss Woods that she would be back soon, but instead she was gone for hours with other patients while Miss Woods needed her. To overcome this barrier, the nurse rushed back to the room as soon as she realized Mrs. Woods' results were in, and she was able to apologize. Miss Woods was very understanding and forgave her. Lastly, during the termination phase, the nurse felt like she had gotten too close to the patient and it would be hard to leave her. This barrier was resolved when the nurse talked with her supervisor, creating a bridge. Watson's theoretical view on caring was displaced during this therapeutic relationship. Some examples that show how this view was used is when the nurse was able to develop a supportive environment and instill hope when the patient was talking about her fate and her feelings about terminating her pregnancy. The nurse was able to gain Mrs. Wood's trust right from the beginning, which made the entire relationship trusting. Lastly, the nurse was able to always put caring first with Mrs. Wood.